Welcome to iLabMD, our functional medicine clinic. My name is Dr. Maria Azizian. I'm a founder of iLabMD. So in today's video, I would like to discuss what services we offer and how we can guide you or help you in your quest for better health. So I thought that it would be the best if I start with an example of our typical patient. Of course, I'll change the name and some details, but let's start with that. Ashley is a 40-year-old female who has been suffering with migraines and eczema for decades. And she has seen neurologists and dermatologists. She has been prescribed anti-migraine medications that helped to a degree, and she has been prescribed steroid creams for her eczema. However, as time went by, her migraine episodes were not getting better, and she continued to have 2 to 3 migraine episodes per week. And her eczema flare-ups were a little bit better. They're once every 3 to 4 weeks. And she did have a chronic mild eczema in between the flare-ups as well. Additionally, Ashley was not interested in continuing to take medications and using topical steroid creams. Occasionally, she was also prescribed oral steroid for eczema flare-ups. So at some point, she started looking into her diet, into her lifestyle, and she eliminated some foods that she thought could be triggering. And it did help. Actually, her both conditions got better, but not enough to really make a huge difference. And at that point, she started feeling stuck. And that's how she came to iLabMD. She came into functional medicine, the world of functional medicine. So as we started our work with Ashley, of course, working with a patient in a world of functional medicine, it's always a partnership. So meaning that we work together on the same issue. So we start, of course, with a comprehensive medical history, and that medical history doesn't only include, medications and allergies and family history, past medical history, but also it includes important information about the lifestyle. What is the level of stress in this patient's life? How much do they exercise? Do they just walk, or do they do strength exercises as well? What are their social connections? Do they feel connected, or do they feel isolated? And the most important thing is, of course, the diet. Diet is very, very important because it's the base of healthy life, and it's where we start in functional medicine. So in working with Ashley, there are several things that we found out. One of them was her sensitivity to certain foods that were not a common trigger foods that she even suspected of being a trigger foods for her. But in general, they're not common known trigger foods. And one of them, interestingly, was caffeine. And she loves coffee. She drinks used to drink 2 large cups of coffee per day. And because food sensitivities, they don't come right away, they can take up to 3 days. She was never able to make that connection. And also her gut testing showed that she had some overgrowth of bacteria and also had some yeast in her gut. So based on the testing, based on our sessions together, we were able to make changes both in her lifestyle and in her diet. And she is a very willing partner, a very willing contributor to her own health. And as a result, there's a significant improvement of her migraine episodes. Now she gets them once every 3-4 months or so, and she hasn't had eczema flare-up in a very long time. So that's all very encouraging, and that's sort of an ideal scenario in the world of functional medicine. But first, a few words about functional medicine. What is a functional medicine? Functional medicine is a personalized medical approach to chronic condition. And it is based on lifestyle changes, as I mentioned in this example, that include sleep, exercise, stress, social connections, diet. And it also is based on testing, individualized testing, meaning testing that you would benefit from, not just generalized testing. And same thing could be said supplements, because the choice of supplements, something that you can't get through the diet, or you can't absorb enough through the diet, even if you eat completely 100% healthy, these supplements have to be personalized to you, tailored to you, and not sort of generic supplements that we all need to take this and that. So that's the concept of functional medicine. why is our clinic called iLabMD? So iLabMD is a functional medicine clinic. It's both virtual and in person. If you happen to be in Cape Cod, we're happy to see you. It's both virtual and in-person clinic. The word lab implies that we do testing. Testing is very important because I know of situations where, especially in functional medicine, patient is treated because there's a suspicion of this and that. For example, oh, I think that you may have yeast in your gut. But you know what? That's not good enough, because if you treat something, you have to have a scientifically documented and proven fact that this person does have that, because you can't just use your suspicion. I'm all for medical intuition. However, I think that testing and scientific backgrounds, it's extremely important for any diagnosis and any treatment that you initiate with the patient. So testing is extremely important. And on our side, we have variety, tons of testing options, such as gut testing, food sensitivity testing. We have genetic testing, hormonal testing. We have epigenetics testing, and many more. There are just so many interesting tests, and they're all getting better and better as there are more lab companies that are trying to outdo each other. So it's a very interesting and a good time for functional medicine testing, because there's so many biomarkers and parameters that we can now test. So that's the lab component of our clinic. The MD refers to the presence of a physician, which referring to myself. And it's very important because this is not just some test that you get without interpretation or with just baseline interpretation by a physician who doesn't know you. The key in interpretation is that it has to be personalized to your symptoms, and also it has to be by somebody who has been trained. A lot of these tests are very, if not a lot, probably all of them, I would say, are very sophisticated, and they do require a special training that I underwent as part of becoming a functional medicine provider. And that's very important to have that personalized component to the testing. Otherwise, honestly, the testing could be just useless or too complex to understand how it applies to you and to your symptoms. So that's why it both iLabMD. So, and a few words about myself. So I'm a board-certified general surgeon and a functional medicine provider who is certified by IFM, which is Institute of Functional Medicine. Being a surgeon, actually, I see usually sort of the end result of lifestyle choices and diet choices, meaning that I see a gangrenous gallbladder or I see a perforated bowel. And that, of course, it always makes me sad. And I always thought of, wouldn't it be nice to prevent that, to prevent a patient from losing this organ, such as removing the gallbladder or cutting a section of the bowel because it's perforated and it's not viable anymore. So, and that's what brought me to a functional medicine, where I wanted to look at the root cause, and those are the words that we use a lot in functional medicine, root cause of these chronic issues. Because when somebody comes in with a perforated bowel, it's usually not something that just happened. It's been festering and festering and festering, and then sort of it came to the condition, at least in most cases. So additionally, my other passion is a skin disease. So I'm also a founder of Mindful Medical Care, which is a skin cancer clinic on the Cape in Falmouth, Cape Cod, and where I treat benign and malignant skin conditions, both diagnosis and removal, etc. So, and what I also am very interested in merging these two worlds of functional medicine and skin disease. And that's what led me to writing a book about food sensitivities and in chronic skin conditions such as eczema, acne, psoriasis, rashes, itching, etc. And it's called The Clear Skin Diet, basically looking into connection between sensitivities, food sensitivities and skin health. And along the same lines, I also have a YouTube channel where I talk about mostly about functional medicine topics. And there's so many of them because there's more and more coming out each day. So I can't even keep up with that. So that's about me. So now, what services do we provide at iLabMD? So number one service that usually I recommend as a start is our initial personalized health report with 15-minute consultation. So what is it? So once you register for that, you fill out medical questionnaire, of course, medical forms. You have to have medical forms. There are always medical forms. So you fill it out, and then it comes to me, obviously. I review your intake, your questionnaire, and it helps me identify what is the issue, what is one or two or three main issues, where to get started. Why did we create this service or this report? Because a lot of times I hear from our patients that, oh, I don't know where to get started. It's so overwhelming. Oh, I think I need hormonal test. Oh no, maybe I should do gut testing, etc. So that's why this is to help you to get started and for me to guide you. Because what you do, so I provide this report within 24 hours. So you see where I recommend that you get started, which tests I recommend or not recommend, or what other direction you need to go in. And also, after you get that report, we schedule a 15-minute visit based on that report. And that visit could be in person, or it could be, if you're in a cave, or virtual via phone or Zoom, etc. So video or phone visit, however you prefer. You have an option to check that when you schedule that. So that's a good test to start with. And what are the outcomes of this report? So this report is not comprehensive, obviously. And in this report, I don't review labs. I don't review a previous study because it's not built into these initial tests. It's basically get to know each other report. And in some cases, I would say, I think we should start with this. We should focus on your, for example, gut, or I think we should focus on your thyroid, for example, or this immune condition, through food sensitivities or etc. In some cases, I may recommend that you need to see somebody else before you see us. For example, if you have not seen a provider for some time, your regular primary care provider, and a lot of your symptoms that you indicated in this questionnaire showing that you may have serious gut issues, and now I'm suspecting that you may have a colon cancer, then of course, in that situation, I would strongly recommend that you undergo colonoscopy first before getting into the world of functional medicine. And you can do both, of course, but colonoscopy has to be done. It's very, very important. So, or let's say similar type of example, let's say somebody is complaining of a brain fog, but when you read their questionnaire and you talk to them, you see that they may have had some silent strokes because their symptoms are much more than just innocent brain fog. Relatively innocent, I shouldn't say that, brain fog. So of course, they need to see a neurologist. So basically, there are different outcomes depending. That's why it's an individualized report. And I think it's a good way to start. We made it accessible. We made it inexpensive. It's $50. And like I said, it includes a report that you get from me within 24 hours. And then a 15-minute visit where we summarize things. You can ask more questions. And also, I think it always helps to talk to each other in a sense of for you to see if this clinic is a good fit for you, if you like the vibe, and just for both of us to see if we are a good fit to work together. So it's good to have that 15-minute visit. So that's one way. The second type of services that we provide is testing. Let's say you've always wanted to do a gut testing and your friends had it, your family had it, and you're very curious and you have some symptoms, or maybe you don't have any specific symptoms, you're just interested. Then you can just go ahead and purchase the package that includes gut testing and includes test interpretation. For tests that we offer, and I would say for probably all functional medicine tests, a trained interpretation is required. That means that we can't just, of course, patient can just get the test results, but if they're not interpreted correctly, they wouldn't know what to do with it. That's why companies that provide these tests, they offer specific training for the providers to actually learn how to interpret this. And I have, of course, trained in all these tests. And when new tests come out, I get on that and train in new tests as well. It's very fascinating, very interesting. So I always recommend, of course, having this consultation and not settling for any tests or any generic interpretation. Generic interpretation when somebody just interprets your test without tailoring the symptoms to you. So they say, oh, you have this, but it doesn't connect your symptoms. And that's really is the cornerstone of personalized medicine. So these packages, so you can go ahead and let's say you purchase the package. The package includes the actual test kit that you get within, I think that very quickly, it depends on the company, but it's usually 1 to 2 days. You get that kit to your home and you do it at home. And these packages, they're usually a finger stick or stool, in some cases urine or saliva. So we do have a package with a blood draw, but we usually discuss that and give you an options as to how to get that blood draw. But 99% of packages do not include the blood draw. It's a finger stick or, like I said, other stool or saliva, etc. So you get the kit, and once the test results are in, then you and I meet and we talk, we discuss and basically dissect this test for an hour and what to do, and I make recommendation as to what is the next step. So that's sort of the second way. The third way is if you want to start working with a functional medicine provider like myself, then you can start with a comprehensive 16-minute initial consultation. And in that consultation, I will review your previous testing, your previous labs, and whatever you have, images, etc. And of course, we'll talk about the questionnaires. It's more comprehensive. There's more time. And of course, I will urge and ask you in our communications to provide those labs before the visit so I can get prepared. So I'm ready when we meet and we go over things. So that's another way to get started. The fourth way, if you really want to just get started with the whole thing, you're motivated, which is wonderful, then we have a treatment course that includes 6 visits. That includes a 60-minute initial visit and 5 follow-ups. And basically, that's how we get started in working together. And this is could be over 3 months, which is average, but could be less. Let's say if your issues are more severe or we need more follow-up to see each other more frequently, or it could be over a longer period, let's say 4 or 5 months. It all depends. It depends on the person and depends on their conditions. So those are 4 tests. But again, I would stress out that I do encourage the first one to start with the first one first. It guides you. It provides a personalized report. We meet for 15 minutes as well. So it basically gives you the gist of functional medicine and what we do. And also we meet and kind of see if we are a good fit for each other. So the next point that I would like to make is how we communicate. So all communication that affects the medical data about you, your medical confidential data, is done through the company platform, actually, that's called Get Healthy or Healthy. It's a very nice platform that is utilized by many clinics, providers, and we use it as well. Why? Because it allows for a patient to share their test results very easily, photos, and it's HIPAA protected, including the Zoom visits. Everything is done. The payments, the Zoom visits, sharing of the results, everything is done through that platform. So it's protected. So that's that. And who could become our patients? So we only treat adults. So we only are open for residents of Massachusetts, New Hampshire, and Vermont. And that's because I hold medical licenses in those states. Or let's say if you're visiting here in the Cape and you're in Cape Cod, you can come physically, then we can see you physically, of course, at our clinic. And finally, I would like to say that especially in the world of functional medicine, but in the conventional medicine as well, there are never guarantees of a cure. If somebody guarantees that they will cure you, you'll be 100% a new person and everything will go away, that's just too good to be true. Usually with functional medicine, progress happens, well, sometimes it's fast, but usually it's slow. The progress is slow because those are chronic conditions that we're dealing with. There are not some quick something that came on, the rash that just came on, like a poison ivy and then went away a few days later. No, we're dealing with chronic issues. And that's why it takes time. And what I see in working with our patients, that there's just amazing improvements, because sometimes people come with just a couple of complaints, things that they focused on. But then once we're done with the treatment or kind of done with the core of our treatment course, they tell me, oh, I feel so much better in this regard than this. I feel kind of brighter, I have more energy, and I feel more focused, and other things that we didn't specifically work on, but they are basically a byproduct of healthy living. And also, in addition to the fact that there is no guarantee for cure, there's never guarantee for cure, but because this is a partnership, our patients are motivated, and usually they work hard. They work hard because hard work is required. Changing your diet is hard. Taking supplements is easy for most patients. So usually there's more compliance with taking supplements, but changing diet is hard. It's hard for all of us. So, and that's why everything that happens, it happens organically. It happens with time. Unfortunately, there are some advanced chronic conditions that you can't obliterate them. They are just, at least right now at this level of medicine, you can't completely get rid of them, but you can make things better. You can improve the symptoms. I hope this has been helpful for you, and hope to talk to you, hope to meet with you. And thank you so much. Have a beautiful day.